lumbar laminectomy, where we decompress the lumbar spine for stenosis, removal of the lamina here. This is the lumbar spine. There are 5 vertebrae in the lumbar spine. The spinal cord ends high between the first and second vertebrae, and the nerves that continue after the spinal cord travel in this canal. That spinal canal in stenosis is narrowed. So narrowing of that canal is stenosis. And the way that's treated after failure of medications and injections, if one's still symptomatic, then we offer them surgery. Surgery is to remove the back part of the vertebrae. That's called a laminectomy. This is the lamina. So under magnification, we drill this part of the vertebrae off and remove it and find each nerve that's affected and make sure that they're not compressed. We'll have to drill that bone off and use other instruments to remove bone and ligament that's compressing the nerve. That procedure takes about an hour to do, hour and a half to do per level. Oftentimes we do more than one level. And the risks of this operation are bleeding, infection, spinal fluid leak, nerve injury, and it can actually make back pain worse. It really does, but can. And this is an operation, too, designed to treat the leg pain, not back pain. That procedure is usually an overnight hospitalization. Sometimes we'll send a patient home the same day. Commonly, there'll be a drain placed. The drain evacuates any kind of blood that accumulates after surgery. The goal is to have patient up walking the same day of surgery and home the next day or the day of. When patient goes home, they need to keep the dressing dry unless there's obvious drainage that we can see from the outside. Then we'll instruct you on how to change that dressing. You'll go home on antibiotics and pain medications. You can walk as much as you want from day one. No lifting more than 15 pounds. You can drive, but we give you clearance to drive.